So there's a common misconception out in the public domain that people have diabetes because they just ate too much sweet and sugary food. But in fact, diabetes is a really complex medical condition.
Welcome to Daily Dose with Dr. Tanya. We're going to talk everything about health, wellness, beauty, and things between. This is your space where we will have real conversations, real results for real people. So let's get started. Today we are talking about diabetes. Hi, I'm Dr. Tanya and you're watching Daily Dose by Dr. Tanya. So diabetes is a condition that more and more people are getting concerned about it and they're talking about it. And today we're doing the episode because a lot of patients have asked me to share what we know and how they can help themselves at home. So today we are joined by Jill, who is a diabetic educator, and she works at the Amtan Medical Centers. And I'm really excited to talk to her because she has got a lot of knowledge and a lot of things to share with us. So can you tell a little bit about yourself, your experience and your training and in this field?
Yes, thank you so much for having me on the Daily Dose, Dr. Tanya. So my journey as a diabetes educator is grounded on 10 years of experience as a pharmacist. So I've got a strong knowledge about medications and how medicines play a part in managing diabetes. And then after that, I've done some postgraduate studies, specifically just diabetes, all types as well. And then to finally get my credentialing, I had to do 1,000 hours of clinical practice. So that is a really good preparation. You really see all the different types and presentations of diabetes and how it's not a one-size-fits-all approach. It's really unique. So yeah, I'm very grateful to be part of the Amtan group for the past 3 years now.
Wonderful, Jill. And for viewers, can you let them know what does a diabetic educator do? What is your role in the whole multidisciplinary approach to diabetes?
I've been part of the Amtan group for the past 3 years, and I've been exposed to people living with diabetes from all walks of life, ages and stages, and it really is not a one-size-fits-all approach. Every situation and living circumstances is unique, and so it does need that tailored approach, and you do need that whole team working behind you. So this is where people like Dr. Tanya come really important for you to have coordinated care. I'm part of the team, but it's a whole team, not just diabetes educator and GP, but you've got people like dietitians, podiatrists, psychologists, exercise physiologists, physiotherapists, podiatrists. They're all important and they're here to help you live a long and healthy, happy life with diabetes, because I'm glad to say that in 2026, the advances in modern medicine and the care that you will receive here in Australia is world class. So I just want to encourage you, if you have family living with diabetes, if you yourself are living with diabetes, just want to encourage you to engage with your team, because I want to empower you and help you to reach your health goals and help you to manage your diabetes in the best way possible.
My gosh, I can feel the passion that you carry in helping people with diabetes. And you're quite right. It's not like one team approach. It is multiple therapists and multiple specialists are involved, like GP, the nurses, diabetic educator, the podiatrist, the pharmacist, your specialist, all of them are all going to work together to help you to deal with your diabetes. So I can feel the real passion that you have. That's really is infectious. So what do you think actually people get wrong when they have diabetes?
So there's a common misconception out in the public domain that people have diabetes because they just ate too much sweet and sugary food. But in fact, diabetes is a really complex medical condition. It has so many different risk factors and causes. There's different subtypes. For example, someone with type 1 diabetes, it has nothing to do with what they ate. You can have an 18-month-old baby diagnosed with type 1 diabetes because their immune system has attacked the cells of their pancreas, so they can no longer make the hormone called insulin, which allows them to absorb the glucose from the bloodstream. So that's just one type. Then we have type 2 diabetes, which is more about managing lifestyle factors. Yes, that's a huge part of type 2 diabetes, but not all people with type 2 diabetes are overweight. Some people have risk factors, like maybe their mother and father both had type 2 diabetes. Maybe they're from a certain ethnic background that gives them that genetic predisposition. Maybe they have history of gestational diabetes. So that's type 2. Then we have things like type 3C diabetes. This is a new and emerging space being linked to dementia. And then we have MODY, mature onset diabetes of the young. And we also have LADA, latent autoimmune diabetes of the adult. So as you can see, it's not a one-size-fits-all thing. It's very unique, and understanding the person as a whole is going to help us create a tailored approach to management.
Talking about the management, what do you find patients struggling with? Like, what is a common man's challenge when it comes to management?
So one of the questions I get asked the most is, what do I eat? I guess I can't eat chocolates and fruits anymore and ice cream, right? But it's so much more than that. So it's really looking at what impacts your blood glucose in terms of sugar and carbohydrates. Yes, that's a big part. But where does other factors that you may not have considered come into play? For example, did you know if you're living with chronic pain, or maybe you've got an acute pain episode, that's going to elevate your stress response. You're going to release hormones like cortisol, adrenaline. That's going to cause you to release blood sugar into your bloodstream. And then you're also going to be more insulin resistant. Then you've got things like stress. Chronic stress is a huge factor in modern life today that's increasing people's insulin resistance, leading to weight gain and problems with controlling their diabetes. And then we've got certain medications. They can also increase your blood sugars. That's just a few factors that are not anything to do with your diet, right? So this is why you need to come and see your team so you can understand all the different complexities and how it impacts you.
And the lifestyle factors, I believe it's a very important aspect in managing the diabetes. So can you tell us a little bit more about it so the viewers can understand? Yes, it's about the diet, but also your lifestyle matters as well. So can you elaborate on that?
So when we're looking at lifestyle, we're looking at the diet, we're looking at stress management, we're also looking at sleep. That is a huge one that I would like to talk about today.
Whoa,
so
sleep.
Sleep. No one really thinks about diabetes and sleep, but if you're living with obstructive sleep apnea, for example, and you're not getting a good quality sleep, that's going to increase your insulin resistance. That's going to make it more difficult for you to control your blood sugar, or it will predispose you to actually developing type 2 diabetes. So sleep's really important in helping us regulate blood glucose, and also in helping to have adequate rest so that we can cope with our emotions and stress throughout the day. Sleep also can influence the leptin and ghrelin hormones, which control appetite and satiety. So that's why sleep is often overlooked. And I do focus a little bit on that in my consultations to help people get a better quality sleep. We can use supplements, different stress management techniques, or dive deeper, maybe with a sleep study. Maybe you don't know that you have obstructive sleep apnea. We don't know. So we can do a whole host of different things to improve sleep. The other lifestyle factors is the more obvious ones like not smoking, because smoking increases inflammation, smoking increases insulin resistance, making it more difficult to control diabetes. Smoking also constricts your blood vessels, so that's going to make it really hard for the blood to flow out to those small blood vessels. It's usually in the fingers and in the feet. We're getting things like numbness and tingling. That's because your high blood sugar attacks the small blood vessels and the nerves in the extremities like the fingers and feet. So then we end up things like the numbness and tingling. Worst case scenario would be amputation. That's if you're really not engaging with your team or monitoring your blood glucose. But then if you're adding smoking into that equation, you can see how there's already that nerve damage happening from the blood sugar. And then you're adding on top of that the inflammation and the insulin resistance, and then the constriction of the blood vessels, making it really hard for blood to get down there. And so I do see a lot higher incidences of these complications in the feet and fingers because of smoking. Then we've got things like exercise. That's a big one. Exercise is important for all types of diabetes. And it's an underutilized tool. And I think that the best exercise that you can do is the one that you'll do regularly and that you'll enjoy. There's really no rules. It's just really about getting started and getting moving as soon as possible and as often as possible.
Yeah, wonderful. I thought, for people who are watching or very newly diagnosed with diabetes, what is going to be your advice as how do they manage? Like you got your blood test, it's confirmed that you got diabetes. So what next? Your team of specialists, how often you should see them, how often you should get your blood test, and the little tips that they can do at home. Can you maybe give us an idea of that? So
Sure.
It'll help.
So that's a really good question, by the way. So there's a lot of things that people can do at home, what we call diabetes self-management, and that is the main role that I play in all of this. So if you're newly diagnosed, I would say your first port of call would be to ask your GP for a care plan referral to see a diabetes educator. Then we can really hone in on some of the lifestyle factors that you need to tweak or improve. We can look at some dietary guidelines and then come up with a plan. After that, I would recommend that you see the dietitian for some tailored meal advice, meal planning. That's really good. And then podiatrist at least once a year. That's so important. So at least once a year, you need to go to the podiatrist because they're going to check for blood flow, sensation. They're going to make sure that they're detecting any complications early on so that they can be addressed, so that we're not having things like ulcers or amputations later down the track. You should also get your eyes tested at least once a year. And please tell the optometrist that you have diabetes, because they'll be able to do special scanning to the back of the retina to detect damage to the retina early on. And the other thing to do would be to keep in touch with your GP regularly, getting your HbA1c blood test at least every 3 months, because that's going to give us a good indicator of how well your diabetes is being managed. And one of the other things that you can do at home is being aware of your own feet. So things like checking your feet every day. Just look in between your toes, check for areas of redness, swelling, cracking. If there's any big cracks or anything unusual that's different for you from your feet, then go and show your GP straight away so that they can act on that and get it solved. Because if you leave things too long, then if there's an infection, it's going to be taking a long time to heal because of the diabetes affecting wound healing and blood flow. So that's another big one. And wearing shoes inside the house, please avoid wearing bare feet so that you're not accidentally cutting or hurting your feet inside the home.
Yeah, I think those are very useful tips, because you have listed as soon as you get diagnosed, what are the things you got to think about, who is your team, your medical team, and that team is not just for once or twice. That team is going to help you throughout your diabetics journey. So before we conclude, I want to actually ask you some common myths that I've heard, so you can tell me and help the viewers what your opinion and your thoughts are. Sugar causes diabetes.
That is very black and white to answer. As you know, I've been talking about how complex diabetes is, and definitely carbohydrates do break down into sugar and have a strong impact on your diabetes. But don't forget that fat plays a huge, huge impact in insulin resistance and inflammation. So it's often a strong combination of both fat content and sugar content coming into the diet that is playing the biggest impact.
So the second one, if you are diagnosed with diabetes, you cannot have carbohydrates. Myth or not?
So I get asked that a lot as well. So carbohydrates are not all bad. Carbohydrates are definitely not all created equal though. So carbohydrates are one of the preferred sources of energy for the body, because they get converted into glucose inside the cell, and then inside the cell they're converted into energy. And we use that to power the cell and carry out all the various functions throughout the day. But carbohydrates are rich in vitamins, minerals, fiber, so they form a really important part of the diet. So it's really about being aware which foods are very high in carbohydrates, and it's really important to pair them. So I always talk about not eating carbohydrates naked. So what do I mean by that? So if I had, say, a cup of rice on its own and I had to chart my blood sugar over time, that cup of rice is going to affect my blood sugar so differently than if I just had that cup of rice, but maybe I had 100 grams of cooked lean chicken breast and a side salad. So now I'm not eating carbs on their own, they're not naked, but I'm pairing it with protein and non-starchy vegetables, which is like really high in fiber. And that same amount of carbohydrates coming in is now going to give me a nice smooth curve, instead of like a sharp increase and decrease. Because when you get those sharp highs and sharp drops, you're going to feel irritable, tired, and you're not going to have sustained energy release. So that's what I mean about not having carbohydrates naked.
That's a very good one. If you are on insulin, this is what I've heard a lot. People think, if you're on insulin, that means your diabetes is really bad. Myth or not?
That's a very big question I get asked all the time, because it is an injection, right? It's not a tablet. So people try to avoid going on insulin, and they perceive that if they're on insulin, my diabetes is now at the end stage. Insulin is being advocated now to be started earlier on, because often insulin can help you get to your target blood glucose a lot faster, and it's a lot more powerful than some of the tablets that we use. Diabetes is a progressive condition, so it can often be that people with long-standing diabetes that have been doing really well on their tablets for the last 10, 15 years, suddenly those same doses of tablets, and they're not responding to them. And that's more to do with the beta cells inside the pancreas. They're starting to get worn out. Some of them are starting to malfunction. So when we keep throwing tablets at that equation, there's no response from the pancreas. So then that's where we need to inject the insulin externally with an injection. Could be just once a day in the evening or multiple times a day, depending on your situation. So you're sort of giving the body what it needs. And we're trying to encourage people, if they're at that stage that trying not to delay insulin so much so that they're not having all this like cumulative damage to their organs from being at a high blood glucose for so long. We'd rather get in there earlier with insulin so that we can get your body back to a safe level.
So important. It's often overlooked. Next, quite an interesting one that I'm sure you get asked a lot. Fruits. Can you eat fruits if you're diabetic?
Yes, you can.
Yay!
Quick answers. Yes, you can. A lot of clients of mine are strong fruit lovers. I myself love fruit. I'm all about, yes, including fruit in the diet, but really looking at how often, how much, with what. So with fruit, I like to encourage you to have it in between meals. And the reason is when you're having it as a snack rather than straight after a main meal, then you're reducing the carbohydrate load of that meal. So that's going to make it a lot easier for your pancreas to process that. So in between meals, and also not all fruit are created equal. For example, did you know that if you ate 2 entire punnets of strawberries all in one go, and then your body broke that down, that's the same amount of sugar as 1 medium apple. So that's how different it can be. So strawberries, yes, they're on the lower end of the spectrum. They're great to snack on. And then we've got other fruits up on the other side of the carbohydrate spectrum. So things like dried fruit, mangoes, grapes, bananas. They are much higher in carbohydrate content. So if you're trying to eat grapes, maybe 8 to 10 grapes, that's already 1 serve of fruit. Half a mango, that's already 1 serve of fruit. If you're having a banana, try and go for the greenish, yellowish ones rather than the big ones with all the brown freckles on them, because
That's
they're
more
going to
yummy.
they're a lot higher in sugar. So the guideline is 2 serves of fruit per day. Don't forget that includes fruit juice, dried fruit, and tinned fruit.
And how do we replace sugar? What's your suggestion? Go with artificial sweetener, or is there something that you would recommend? Because some people like the sugar in their coffees and teas.
I know, right? Me too. So I'm all about natural. So let's go for things that our body recognizes as natural. So let's sweeten our coffee with jaggery, honey, raw sugar, or preferably if you really want to bring down that carbohydrate content, go for things like monk fruit or stevia, because these are plant-based sweeteners. They're not chemicals like ACE-K and aspartame that's made in the lab, and they're not going to trigger inflammation like those can.
That's a good one, because there are a lot of people out there, being diagnosed with diabetes completely changes how they live, their lifestyle, so it's about being smart and understand how the science is behind this whole situation, the pathology of diabetes, and not restricting, but adapting to what's going to be suitable for your body. So our take is go smart, but not hard on yourself and not hard on your body. So with that, I really enjoyed listening to you. Although as a doctor, there are a lot of things that what you said, we're like, oh yeah, of course. But it's just really is important, whether you know about it or not, to go to a professional person, to go to a diabetic educator and take that advice and help yourself by being a part of a team who would further assist to lower your sugar, help with your lifestyle, and improve your quality of life for a lot longer. So with that, we conclude today's episode. Thank you so much for coming and talking to me. So we are signing off. Daily Dose by Dr. Tanya.